Well, thank you everybody for joining me today. I was asked to prepare a presentation to give an overview of what the FYSAS, the Florida Youth Substance Abuse Survey, is about, as well as some of the recent research that I and some of my co-authors have published using some of that data since about 2017. So thank you for attending. I think we have kind of a wide variety of FYSAS stakeholders, as well as, I hope, some junior scholars or academics who might be interested in learning about the FYSAS and potentially using it for their own research purposes. So my overall goal today is to give a little bit of background on the FYSAS for those of you who might not know a lot about it, and then also to go over about 5 or 6 studies, some that have already been published and others that are currently under review or in development using some of the more recent 2019 and 2020 FYSAS data. So I'll basically break down the presentation today into 4 components. The first one being extremely brief so as not to bore everyone, but I'll give a little bit of background just about myself and my own research interests. And then I'll give some of that more expanded background about the FYSAS, the content of the survey, how that content has evolved, and some of the newer items that appear on the survey that researchers might be highly interested in. I'll then go over some of the recent studies that I've done, noting those that I've led as well as those that I've co-authored, and then we'll have plenty of time for open question and discussion. So I got my master's degree and my PhD in criminology from Florida State University. I finished my doctorate in 2010. I studied under Dr. Carter Hay. I've been a member of the faculty of the Department of Criminology and Criminal Justice at Florida International University down here in Miami. Since 2010, progressed from an assistant to associate to most recently a full professor. And I'm also the director of research and communications, and I manage all of the department's social media accounts and try to promote our programs, our students, and our research. So my primary area of research is all things related to self-control. Its causes, its antecedents, the consequences or outcomes of deficits in self-control, whether they be behavioral or attitudinal or health related. I also study kind of the stability and change or the development of self-control over time. And that goes all the way back down into early childhood up into young adulthood, as well as kind of the intergenerational transmission of self-control. So I've published research and have research under review that looks at the link across generations and levels of self-control and the different both social and genetic factors that might link intergenerational transmission of self-control. What I'm going to focus upon more today is some of my other kind of expanding research interests that relate to sleep quantity and quality, digital risk behaviors, including recent research that I've done focus upon what we call digital self-harm. And I'll explain what that is when I get to that particular slide. And then also racial and ethnic disparities in school suspension and juvenile justice outcomes. And that is one of the studies that I'm really excited to be able to highlight today using some of the FYSAS data, is looking at very nuanced differences in school suspension across a 13 item or 13 category measure of race and ethnicity that the FYSAS enabled my co-author and I to construct. So the FYSAS, or the FYSAS as it's called, was first administered in the year 2000. It's based upon or modeled upon Hawkett's and Catalano's Communities That Care survey, which was one component of the Seattle Social Development Model. And so this model is based in part upon a risk and protective factors framework to understand the etiology of substance use and delinquency. The survey has been conducted, the FYSAS has been conducted every year since the year 2000, and it is administered in coordination between multiple Florida state agencies, including the Department of Children and Family, the Department of Health, the Department of Education, and the Department of Juvenile Justice. So the thing that is somewhat interesting or beneficial about the FYSAS is the administration differs a little bit between even number years like 2000 and 2022 versus odd number years like 2017 and 2019. So in even number years, the sampling strategy is extremely large so that not just statewide estimates of substance use and other indicators can be measured, but individual county level measures. And we have 67 different counties within Florida. So in order to produce reliable county level estimates for each of those 67 counties, right, you can imagine that there's a very large overall statewide sample that ends up being produced. So in even number years, more than 50,000 students participate in the FYSAS. In odd number years, the overall goal is to produce just statewide estimates of substance use and other indicators. So the sample's quite a bit smaller. It's usually around 10,000 students who participate in odd number years. So that does have some implications for particular research questions that academics might be interested in wanting to address if particular behaviors are very low in terms of prevalence, or certain groups or subgroups of individuals of particular racial or ethnic categories might be relatively small in the population. Using data from the even number years is going to be more beneficial because you're going to have an overall much larger sample size and therefore much larger subgroup sample sizes. So in each of the years that the FYSAS is administered, separate samples of middle schools and high school students are drawn. The school participation rate is very high. Greater than 90% of schools each year agree to participate. So very, very few schools deny access. And then the student participation rate fluctuates between the middle school and high school version as well as from year to year, but it's generally between about 65 and 75 student participation rate. And that's generally on par with some of the other large scale national studies like the National Longitudinal Survey of Youth and the Ad Health.
I just want to make sure we get all these training links right. So,
sorry. Oh, okay.
Right,
so
right.
Sorry.
Right. So we can do the one on the 28th. But what she does is she does send a link where they go on and they just do the 2-hour training on their own. So yeah.
I'm sorry, Christina, are you speaking to me or are you speaking to someone else? Could you mute if you're not speaking to me or?
Right. Okay.
All right, sorry, I'll go ahead and continue. Oh, there's somebody in the chat box.
Right. Okay. All right. So she's going to send us the link and then we send the link out to the
please
training.
mute.
And then does that make sense? That's right? Okay. Yeah. Right.
Okay, sorry about that. All right, so I'll go ahead and continue what I was describing. So sorry about that. I've thrown off a little bit.
Yeah, I just got on. I was like, Harry.
So in terms of the content of the FYSAS itself, over the 21 years that the survey has been administered, there have been some items that have been added, some that have been removed, and others that have been modified. But there is a fairly large core set of items, certainly more than 80% of the items that appear on every year of the survey. So these include items related to substance use. So within that, you have a variety of inventories on the survey that capture age of onset. So at what age did you start using a particular substance, if at all, use in the past 30 days, as well as lifetime use. And one thing that is quite, again, unique about the FYSAS is you're not just getting information on alcohol, tobacco, and marijuana, but you're going to be able to collect information on students pertaining to heroin, cocaine, methamphetamine. It's a wide variety of kind of harder classifications of drugs. So all in all, I think it's approximately 20 different illicit substances that are captured on the FYSAS. In addition to that, there are inventories that tap into antisocial and delinquent behavior, some of those things being quite serious, including motor vehicle theft, assault and battery, carrying a handgun to school, things like that. There are also items about perceptions of harm. So if you were to use substance X, Y, or Z, how much do you think you would be posing a risk to yourself? There are also items about people's perceived attitudes about substance use and antisocial behavior, particularly how wrong they feel it is for them to use those substances. There are items about pure substance use, being perceptual measures that focus specifically generally upon the number or proportion of the respondents' friends who use alcohol, tobacco, marijuana, I think vape. I don't believe there's items about pure substance use of harder drugs included on the survey, but kind of the more run-of-the-mill substances are included in that inventory. There are a number of items capturing aspects of the school environment and school bonding, how much somebody enjoys being at school, how much they're invested in school, how hard they try, how much they like it, things like that. There's a number of items about neighborhood context. Up until a couple of years ago, there were specific items tapping into both physical and social disorder in the neighborhood, and those were taken off the survey, but there are still a number of items that ask students to rate how easy it would be for them to get access to weapons and substances within their neighborhood, and their perceptions of how wrong they believe adults in the neighborhood feel it is to use different substances. In terms of the parental socialization or the family environment or context, there are a number of commonly used items that pertain to attachment to parents, parental monitoring and awareness activities, disciplinary practices, items pertaining to kind of family conflict. And then there's a number of items that tap into kind of core demographic variables, age, race, sex, grade, parental education. There is no indicator of family income, but given the number of missing, the amount of missingness on the items for parental education, it would be highly likely that if students were asked to indicate their family's level of income, that there'd be a high number of missingness for that item as well. So those are core items that have been on the survey since the year 2000 and continue to be on the survey up until today, in terms of the most recent 2021 administration. There are other inventories that have been added, including a 6-item measure of low self-control that taps into aspects of risk-seeking, anger, and impulsivity, drawn from the 1993 Grasmick and colleagues scale or inventory, if you're familiar with that inventory from criminology. An item on sleep duration, sleep hours specifically on school nights. Nicotine and marijuana vaping have been added in recent years. And then probably the most notable recent addition to the survey occurred in the year 2020, when a 15-item measure of adverse childhood experiences was added to the high school version of the survey. So there is no ACEs inventory on the middle school version, but it does continue to be on the high school version. And then lastly, I'll just note there have been some one-time or limited additions to the FYSAS. I know other people have made requests in the past. I've made some specific requests for items to be added. And just a couple examples of those would include unstructured socializing with peers, and then also a measure of digital self-harm. And I'll be highlighting some of that research on digital self-harm in just a little bit. So with that being the content of the FYSAS, one of the last things I do want to note before I move on to talking about some of the studies that I've done using the data, is to also highlight the fact that because the sampling strategy is based upon classrooms that are selected within schools, that are then nested within school districts, the structure or the design of the data collection is ripe for multi-level modeling, or considering not just individual level effects, but also kind of macro level effects or meso level effects at the school and at the district level. So I know that in the past, some people have been able to make particular requests to have access to the zip codes in which the schools are based. And with that zip code information, you can be bringing in data from outside sources to link up to the individual student data. So, that is something that I think has been not explored that widely using the data. The one exception I'm aware of is Carla Dungana Sainju, who is at the Ontario Tech University. She was also a student at Florida State, did her dissertation and recently published research using a multi-level approach to look at both the individual level, school level, and district level factors that predict bullying within schools or bullying victimization within schools. That study aside, I'm not aware of any other researchers that have necessarily taken a multi-level modeling approach using FYSAS data, while also bringing in kind of external data, either from the Census Bureau or other agencies. So that is certainly something that the FYSAS can be useful for if kind of considering kind of the contextual factors that might impact individual level student behavior and attitudes. So I just wanted to make sure I highlighted that. All right, so what I'm going to focus upon today in terms of individual studies is just kind of major takeaways from some of the recent publications of mine and my co-authors that in particular have made use of some of the recent items that have been added to the FYSAS, or used or leveraged some of the existing items in a unique way that hasn't necessarily been done, but I think we can answer some really interesting research questions and address some gaps in the literature that are really important. So the first study I want to highlight is one that I wanted to conduct, and this is why I made the request to have a sleep duration item added to the FYSAS. So the first year that the sleep duration item was added to the FYSAS was 2017, and I made use of the information on the self-reports of sleep duration and wanted to look at how students' perceptions of safety, both feelings of safety while they're at school, as well as perceptions of safety within their own neighborhood, and how those attitudes might shape someone's sleep duration. Might impact also their sleep quality, but certainly might impact their sleep quantity. If they have worry and concern and anxiety resulting from feeling unsafe, that might hamper quality sleep. So there are a couple different items that are on the FYSAS that specifically measure perceptions of safety at school and in one's neighborhood. What we basically did is, using those two particular items, my co-authors and I created a categorical measure of feeling safe or unsafe in both those contexts of one's school and in one's neighborhood. And we asked the question, all right, how does the average amount of sleep duration look like? What does that look like for students who feel safe in both contexts, who feel unsafe in both contexts, or might feel unsafe in just one of the two contexts? And we looked at how those perceptions of feeling safe or unsafe particularly were related to sleeping fewer than 7 hours at night, which we look at kind of the normal distribution of sleep duration among adolescents. Less than 6 hours tends to be considered fairly significant deprivations in sleep. So If we look at this chart, this is kind of the main takeaway from the analyses we conducted. These are adjusted probabilities of insufficient sleep, and I list out there down here at the very bottom the control variables, all the covariates that we included in the models predicting this. So at the very right, you see these are students who said they felt safe both at school and in their neighborhood. And 32% of those students indicated that they get fewer than 7 hours of sleep at night. So the question is, how does that compare to other students who report feeling unsafe in those contexts? And so we see that if they feel unsafe at school, but they feel safer in their neighborhood, right? So they feel unsafe in just one context, right? About 40% of those students report getting fewer than 7 hours of sleep at night. If we look at the other group of students who say, well, I feel safe at school, but I feel unsafe in my neighborhood, about 45% of those students report getting fewer than 7 hours of sleep at night. And if we think just about feeling unsafe in one context versus the other, to me, it seems a little bit intuitive that you would expect greater issues with sleep for those who feel unsafe in their neighborhood, because that is the immediate context in which they are sleeping. So I would imagine that perhaps the neighborhood environment might have a more proximate effect on influencing patterns of sleep. What we see as the most problematic is those students who feel unsafe at school and unsafe in their neighborhood. What we might consider, if students are spending 80% or more of their time at school or in their immediate neighborhood environment, that they feel they're in a chronic state of feeling unsafe, perhaps anxious about being in that environment. And we see that more than half of those students who feel unsafe in both of those contexts report sleeping fewer than 7 hours at night. So this provides some important evidence upon how one's immediate and important social environments can have detrimental impacts on, in this case, sleep quantity. It's a separate question whether or not we might see similar effects on sleep quality, which I would anticipate we would probably see those, but that would be a separate research question. So this is the first study looking at what might be a predictor of insufficient sleep among Florida adolescents. The second study I want to highlight then is kind of looking at the downstream consequences. So we know that there are certain things that predict insufficient sleep. What are the consequences or the outcomes of insufficient sleep? This is something that researchers in a wide variety of disciplines have been investigating. Criminologists, I would say, have only more recently started to focus upon sleep quality and sleep quantity as predictors of delinquency and criminal behavior. So I made use again of the sleep duration item on the FYSAS, and the pre-existing items that were already on the FYSAS survey about just general carrying of a handgun, and then specifically carrying a handgun to school. And the analytical method builds upon some previous research that I had done that other researchers have started to utilize, where if we go back 10 years, right, one of the ways in which sleep duration typically was measured, it was just, is a person getting at least 8 hours of sleep at night or anything less than 8 hours of sleep at night. So sleep quantity was oftentimes in analyses treated as a dichotomy. But there might be important differences in terms of risk for certain behavioral outcomes that would differ between somebody getting 7 hours of sleep versus somebody getting, let's say, getting 5 hours of sleep or even fewer hours of sleep than that. So what we did is we broke apart the ordinal measure of sleep hours into discrete hourly intervals for this analysis to look at how deprivations in sleep predict or are related to both the general carrying of a handgun and taking a handgun to school. So this is, again, is kind of the main tables or models that we produced based upon that analysis. Again, down here at the bottom, I list all of the control variables or all the covariates that were all included in the model as well. So these are adjusted odds ratios, and the reference for each one of these two models is getting 8 or more hours of sleep at night. So for example, in this first model here, and I've put in the red box the by conventional standards, the statistically significant effect, where we see youth who report sleeping 4 or few hours at night. And I will note this isn't just a very minuscule portion. According to self-reports, I think it's about 7 or 8% of participants report getting 4 or fewer hours of sleep at night. And that percentage relative to, if we look at some of the ad health data from the middle of the 1990s, that percentage of youth getting fewer and fewer hours of sleep has gone up. So we see that this is telling us that relative to youth who report getting 8 or more hours of sleep at night, those who say they get 4 or less are at a 40% odds greater likelihood of reporting that they carry a handgun. When you look at the adjusted odds ratios for those youth reporting 5, 6, or 7 hours of sleep, right? The odds ratios are above 1, meaning that they are an increased risk or likelihood of carrying a handgun, but none of those effects are statistically significant, right? So these youth are, statistically speaking, no more likely to carry a handgun than youth who report getting 8 or more hours of sleep at night. When we turn to the more specific context of reports of taking a handgun to school, we see a fairly similar pattern, although the odds are a little bit higher for those who report 4 or few hours of sleep at night. So those who say they get 4 or few hours of sleep at night are 85% more likely to report taking a handgun to school as compared to youth who say they got 8 or more hours of sleep. There is some elevated risk for those who report 5 hours. It doesn't reach the conventional levels of statistical significance of 0.05 alpha, but there is a clear pattern here that, whoops, didn't mean to do that. As youth report fewer hours of sleep at night, that odds ratio goes up. So this again provides some evidence that kind of more really extreme forms of antisocial behavior, or more concerning or serious forms of antisocial behavior also are linked to deficits in sleep. And again, I would just call attention to the fact that that analysis included all of those key covariates measured that are displayed at the bottom of the slide. So those are a couple studies that I focused upon, and in particular relating to the causes and the consequences of sleep. So the next study I want to highlight is one that hasn't yet been published. It's currently under revision at the Journal of Research in Crime and Delinquency for a special issue on placing race and ethnicity at the center of criminological research. And so this study utilized what is perhaps one of the most unique aspects of the FYSAS, and that is the fact that the FYSAS includes 2 separate items that tap into racial identity and ethnic identity. And so what my co-author and I did, and this was led by my colleague, Peter Lehman at Sam Houston State University, we used data from the 2018 FYSAS to combine those 2 items of race and ethnic identity to generate a 13 category measure of race and ethnicity. And this is extremely unique in terms of what we see in most studies, especially studies based upon official data, where it might be possible to have like a 4 category measure of white, Black, Hispanic, other, sometimes Asian. But in official data, it oftentimes is even really problematic to have a reliable measure of Hispanic ethnicity, especially if that data is based upon police officer perceptions of the person that they have arrested or cited. So these are based upon self-reports, right, from the youth. And so we wanted to advance research on school suspension, and particularly disparities in school suspension across racial and ethnic identities, as well as biological sex, male and female. So what we did is we used one of the items on the FYSAS that was the self-reports of having been suspended within the past 12 months. And although the item allows for capturing the frequency of the number of suspensions, we just collapsed all of that data down to whether or not every participant reported at least one suspension within the past 12 months. And so adjusting for each of the kind of this extensive suite of variables, which might potentially explain away why you would see disparities in suspension across race and ethnicity, even after accounting for those things. You see that there are significant differences between the racial and ethnic groups in terms of the predicted probability of suspension within the past 12 months. So a couple of things that I would just call attention to this is within biological sex groups, there are significant differences. And you can see that Black non-Hispanic students have the highest predicted probability of suspension. Although I can note what is interesting is that the differences between these four groups here, of Haitian down to Black non-Hispanic, those differences are not statistically different. So there is no statistical difference in the likelihood of suspension across these four groups. We also see some unique differences when you kind of break apart that broad category of Hispanic to look at subgroups. And we see that there's an elevated risk of suspension for Puerto Ricans relative to Central Americans, those who identify as Mexican, and those who identify as Cuban. We see Asian males are the least likely to report having been suspended in the past 12 months. We see some somewhat similar trends when we look at females in the 2018 data, where there's that elevated risk of Puerto Rican females and Black non-Hispanic students and the other groups of Dominican, West Indian, Caribbean, and Haitian. These differences also are not statistically different from one another, but are certainly different from the white non-Hispanic group and these other categories. So what this identifies is when we kind of break apart kind of these kind of broad, kind of monolithic constructs of Hispanic identity or Caribbean identity, you do see that there are significant differences across those subgroups within biological sex groupings. The other thing I would call attention to is we see that those differences or those disparities appear to be particularly amplified for girls. If we compare, for example, right, this disparity for males between white non-Hispanic and Black non-Hispanic, it's about a doubling, a little bit less than a doubling of the likelihood of suspension for Black males relative to white non-Hispanic males. But if we look over here for females, it's about a tripling of that difference between white non-Hispanic females and Black non-Hispanic females. So there are disparities in both of the sex groups, but those disparities appear to be even larger among female students. So, this is a nice way of illustrating a way in which the uniqueness of the FYSAS in terms of having those two separate items about race and ethnic identity can be used to not just look at differences in these 13 groupings across things like suspension, but all of the other behavioral and attitude items on the FYSAS can be examined at this kind of nuanced level of race and ethnicity. And one thing that enables this, again, with the data being collected in the even number years with more than 50,000 students participating, you might have some concern that, well, all right, we see these elevated levels up here for these particular groups, but how many students are characterized that group? And so what I can tell you is that across these 13 categories, that the smallest subgroup sample size is more than 500 students. So there's no issue with like statistical power to detect differences between the groups because each one of the groups is several hundred students in size. So this is I think if researchers are looking for ways to advance knowledge on racial and ethnic disparities, I think the FYSAS is something that can be quite useful for that purpose and go well beyond Peter and I's limited focus upon school suspension. All right, the next couple of studies I want to highlight then are extremely unique in the sense that I requested a item be added to the 2019 FYSAS that taps into digital self-harm. And I wouldn't be surprised if not everybody who's listening has heard of digital self-harm, because as recently as 6 months ago, I had journal editors from youth journals where we were submitting papers on the consequences of digital self-harm, who had to ask us what this was, what the actual behavior was. So digital self-harm kind of was first coined around 2012 by a researcher named Englander. There was a case that at the time was well known, that a girl had committed suicide, and there were some digital forensics that took place that suggested that she was getting cyberbullied online, and that led to her suicide. Additional digital forensics actually revealed that that girl had been anonymously posting mean and derogatory comments about herself online. And this is what the researchers decided to term as digital self-harm. When youth go online or go on social media platforms, either through anonymous chat rooms or creating kind of masked or private social media accounts that are essentially fake and don't enable the person to be identified, that they go on and talk bad about themselves. And so Samir Hinduja and Justin Patchen, who are very well-known researchers in the field of cyberbullying, they conducted the first large-scale study on digital self-harm in 2017, looking at kind of the demographic correlates of digital self-harm, and asked youth in that study to kind of report in an open response format, like why among those who reported digital self-harm, like, why did you do it? And so some of them said, well, I was trying to be funny. Others said they were trying to elicit empathy from other individuals. So I found this somewhat interesting, this concept of digital self-harm. And again, with the wide variety of attitude and behavioral items on the FYSAS, I said, I think this would be a really unique opportunity to advance that research on digital self-harm. So let's add an item to the survey. So a couple of items were added for 2019. And so this graph on the left pertains to a study that came out just a little while ago with some individuals who I've been working with on other studies, where we made use of the sleep duration item and asked, well, is sleep duration related to digital self-harm, right? Because we know that a lack of sleep or poor quality sleep is related to a wide variety of negative and antisocial and health behaviors. Might this also be related to engaging in digital self-harm? So we asked respondents whether or not they had engaged in digital self-harm in the past 30 days and broke that down by the actual number of sleep hours. And so this is just the kind of the bivariate relationship. We went on in the study to control for a number of other things, but this kind of nicely illustrates, you see that there's kind of this linear decline in the likelihood of somebody reporting having engaged in digital self-harm the more hours that they slept, right? And we see that those youth who have the most extreme, or in the extreme category of sleep deprivation, were the most likely to report digital self-harm. So approximately 13% of those youth said they engaged in digital self-harm in the past 30 days. And we see that generally decline the more and more hours that one sleeps, although there is a slight, though not statistically significant, increase as you go from 9 hours of sleep to 10 hours of sleep. There is a small body of research that is suggestive that perhaps excess sleep also could be an indication of some mental health issues going on. But in this data, just because the sample size, again, with this being data from 2019, so this was one of the odd number years of data collection. So the entire sample was only about 10,000 students. When you look at this category of reporting digital self-harm and reporting getting more than 10 hours of sleep, this isn't a very large number of individuals. So there might be kind of an uptick, a swing back up in terms of increased risk of digital self-harm from kind of excess sleep. But we were unable to really get at that all that well because of just the limited number of students in this category. But overall, we do see this relationship, this negative association between more sleep and a lower likelihood of digital self-harm. The other study, which I did co-author with Justin Patchen and Samir Hinduja, as well as one of my other colleagues, Jacob Young from Arizona State, we took some past research that I had done that looked at how bullying victimization can increase negative emotions, particularly those pertaining to a lack of self-esteem and depressive symptoms. And my past research looked at physical acts of self-harm. So my natural question was, might this framework also replicate itself if we looked at digital self-harm? So there are 3 different items on the FYSAS that tap into physical, verbal, and cyberbullying victimization. There's a really nice, very brief 4-item measure of negative emotions that's been validated in a number of studies that generally taps into depressive symptoms and anxiety. And we again utilized that dichotomous measure of whether or not a youth had reported digital self-harm in the past 30 days. So using that data and having a number of covariates that I just didn't happen to list here because I was just showing the figure, consistent with past research, we found that there's this really robust, substantively large association between getting bullied and negative emotions. These are represented in standardized effect sizes, if you're familiar with those. So a 1 standard deviation increase in bullying victimization is associated with a 0.42 standard deviation increase in negative emotions, which is quite substantive. And then correspondingly, we see those individuals who report more negative emotions were more likely to report digital self-harm with that standardized effect of 0.35. We also then tested for what we would call the indirect effect. Does the effect of bullying victimization on digital self-harm operate through negative emotions? And sure enough, what we found is a statistically significant indirect effect of bullying victimization on digital self-harm. So these 2 studies, again, quite unique. I think there's only been about 7 or 8 studies published on digital self-harm to date. And I currently am working on some other research with Justin and Samir, where we look at the link between digital self-harm and suicidal thoughts and behaviors. So I think there's a lot to unpack in this area of research. If you are interested in digital self-harm, again, that item is on the 2019 FYSAS. And then, since I know there's a lot of people who are interested in and do research on adverse childhood experiences, I certainly don't want to neglect that topic since the ACEs inventory was added to the 2020 FYSAS. So this is a study that also is currently under revision at the Journal of Preventive Medicine. It's led by Cashin Basio, who is a researcher at Sam Houston State University, who's one of the only other researchers right now who currently is publishing studies using the FYSAS data. So she's been doing a lot of research related to substance use, and our interests overlap for this particular topic. So what I present here is data from the 2020 FYSAS. Again, it's only high school students. And our particular interest is looking at dual use of nicotine and marijuana. So this is not the full extent of the analyses that we conducted because we did more advanced analyses in the paper. But I think what is presented in this particular table nicely highlights the problematic association between exposure to cumulative ACEs and substance use. So what we did first is we took the 15-item inventory of ACEs from the FYSAS And some of those items on that 15-item inventory pertain to the same category from the standard 10-item or 10 category measure of ACEs that was first produced by Anda and Falidi and other researchers back in the early 2000s who kind of developed the ACEs inventory in the first place. So we collapsed those 15 items down to a 10-item measure to create a variety index of ACEs. And from that, we then created these different groupings of ACEs, ranging from students who reported 0 out of the 10 ACEs up to students who reported 6 or more ACEs. And everybody can take away what they want from this. What I've seen in the literature most often is this typically gets capped off at 4 or more ACEs. But given the sample size we had, and given the distribution of ACEs that I was observing in the data, I thought it could probably reveal some more interesting, more nuance if we didn't cap it at 4 or more ACEs, but extended it out to 5 and 6 or more. And what perhaps particularly concerning is that 1 in 10 youth in the sample, nearly 1 in 10, reported 6 or more ACEs. So that alone is somewhat interesting to observe. The other thing that I think is quite noticeable from this is if we look at these prevalent rates for alcohol use, nicotine use, and marijuana use for the entire sample, right? You see these are percentages. And if you look at that and compare that overall percentage in the sample to how that percentage increases quite linearly across the ACE categories, you can see the clear association between ACEs and the likelihood of substance use. So, for example, we see that 29% of youth who reported no ACEs say they've used alcohol at least once in their lifetime. That goes into the 40s and progresses into the 50s, up into the 60%, all the way up to 70% among youth who report 6 or more ACEs. And we see that type of linear increase for each of the other substance use outcomes that we included in the analysis. And just as an example, again, we see about 12% of youth who report no ACEs say they've vaped marijuana at least once in their lifetime. And that climbs out of the teens or the 10s into the 20s, into the 30%, all the way up into about 44% of youth who report 6 or more ACEs say they've vaped marijuana at least once in their lifetime. So that is one study that is currently under review or under revision using the 2020 ACEs data. I do have some other studies that are in development that are also making use of that data. But I do want to make sure and highlight as well that it's not just me using the data or other professors that are using the data. Several of my graduate students have been making use of the FYSAS data. Most recently, one of my students had an article published in the journal Crime and Delinquency, where he was looking at the link between sleep duration and the likelihood of arrest. Another one of my students who graduated a year ago is looking at the link between unstructured socializing with peers and substance use, using some of that, the earlier waves of, or not waves, but earlier years of data of the FYSAS that included unstructured socializing with peers. And then lastly, I want to highlight that one of my students is currently working on her dissertation using the 2020 FYSAS data to take what is that, generally observed association between ACEs and both delinquency and substance use. And part of what her dissertation is focused upon is understanding the different potential mechanisms or mediating variables that might explain or bridge that link. And so she's looking at, in particular, how low self-control, depressive symptoms, and antisocial attitudes might explain that association between delinquency or between ACEs and delinquency and substance use. So with that being said, those are the studies I wanted to highlight. So I do want to give a special thank you to each of my co-authors that have worked on those studies and also those studies that are still in development. I want to give a special thanks to Waleska Marrero of the Department of Children and Families, Jennifer Richards of the Florida Department of Health, and Bert Rothenbach, who has been the one who's always taken all of the data for the FYSAS and has generated all of the statewide reports on an annual basis. All of the tables and presentations related to the FYSAS are based upon his analysis. So he's been a really important person for the FYSAS. I present the link there for the FYSAS if you want to know much more about the FYSAS, or it's probably just as easy to Google FYSAS, and there's a page that lists all of the annual state reports. This data is available to researchers and to graduate students at universities who want to make use of it. Those inquiries can be directed to Waleska at the Department of Children and Families, and there's a simple application that is required to justify how the data is going to be used. And then lastly, I'll note that for each of the studies that I just highlighted and went over, if you do want copies of those articles, I have them, happy to provide them to you for free. And if you have any questions for me about those studies, just please let me know. Otherwise, thank you for listening, and we can open up the floor to a Q&A for those of you who might have questions or simply want to chat about the FYSAS. So thank you.
Good morning.
Good
I
morning.
have questions.
Yeah.
First question deals with the sleep. How do you, did you all think about just the fact with teenagers and biologically they are sleeping less, and how does that impact into, the data that you shared? And the fact that, like in my county, school starts at 7, and for those students who might ride a bus that they need to catch at 6, and so they're up at 5:30 or 5. And so any thoughts on how that factors in?
So we did control for including the analyses, the age and the grade level of the students. So yeah, so I'm very familiar with kind of the circadian rhythm and the transition that occurs around puberty, where there's kind of the delay in sleep onset among teenagers in particular. And I'm certainly well aware of the issue of school start times and things like that. So the analyses we were running accounted for those age differences. So even after accounting for kind of that natural circadian rhythm change and the delay in preference for sleep onset, we still were seeing those observed associations between the impacts on sleep duration and then the corresponding effects of sleep duration on the handgun carrying.
Okay. And was that data from multiple years of the study or just 1 year?
So the data from looking at the school and neighborhood safety and how that relates to sleep duration, that was just from the 2017 FYSAS. And then the data for this study on linking the sleep hours to the handgun carrying was based upon data from the 2018 FYSAS. So in each of the studies that I've done, I haven't pooled together data from multiple years. I know that certainly could be possible, and then you could include a control variable or a covariate that simply just accounts for the particular year from which the data was taken. The one thing that is somewhat challenging for that is that for some of the covariates that I view as kind of critical to include, for example, in this particular study and in the prior study, I say that I control for neighborhood disorder, and it's like a 4-item measure that taps into student perceptions of how much, how many abandoned buildings there are in their neighborhood, how much graffiti there is, how much violence there is. And I think, I can't remember what the fourth one is, but that's been a very nice psychometrically sound measure of neighborhood disorder. And I think that measure was discontinued starting in 2020. So if I wanted to like replicate my analyses for this and try to pool together data from like 2018 through 2021, I wouldn't be able to have the exact same set of covariates as if I were analyzing data just from a single given year. Now that said, again, the vast majority of items on the survey, the content has remained the same, but there are some key items, at least for my research interests, that have kind of cycled in, cycled out, or just entirely been removed from the survey.
Okay. And then I was wondering which year of the survey data was used for the racial and ethnic studies?
Yeah, so this was also from 2018. The reason, so we didn't pool this with other years as well, because if, for example, we wanted to pool it with 2020, the measure of neighborhood disorder that I just described isn't in the 2020 data. If we wanted to pool this with something like the 2016 data, something like unstructured socializing with peers wasn't in the 2016 data. I can't remember what year low self-control was added, but yeah, anyways, this was from the 2018 data, and many of the studies I've been working on right now use the 2018 data, just because it is an even number year, and it includes, at least for my interests, key criminological variables like the neighborhood disorder index.
All right, thank you.
I have one question in the chat. Let me just pull that up real quick. Oh, okay. All right, that was just a message from Jennifer. Sorry about that. Any other questions or discussion?
Ryan, I have a follow-up question on the digital self-harm area of research. If you had a wish list of sort of future directions to go with that area of research, which was new to me, thanks to you, I had no idea that this was a phenomenon that was even occurring. What would you see as the needed gaps in that literature that should be filled by additional work?
That could be achieved on the FYSAS, or just the gaps in general?
Just in general. I was thinking a wish list if you had additional measures, additional covariates, mediators, moderators, things of that nature that either were included in the FYSAS or could be included in the FYSAS that would push that literature forward a little bit more. What would those be?
So I would say the biggest thing that is needed right now is most of the studies have focused upon, what is the prevalence of digital self-harm? Just establishing how common it is. What are the kind of the demographic correlates of digital self-harm? So how might that vary across age, race, sex, and gender? And then studies have started to now look at, all right, well, what are kind of the other, kind of social behavioral correlates that might predict committing digital self-harm? I think the key gap that exists right now, and this is where Justin and Samir and I are trying to move in that direction, is, all right, we know this phenomenon exists. We know it is, perhaps we could say, alarmingly common. Depending upon the particular study, anywhere between 8 or 10% of youth are saying that they've done this in the past year. So 1 in 10 to me is not trivial. So I think what is needed now is, all right, if digital self-harm is this important thing that we should be studying, what are its effects? What are its consequences? Or at least how might it serve as a red flag for more serious forms of either physical self-harm or suicidal thoughts and behaviors? Some of the research that Justin and Samir already published established that there is a correlation between people who engage in digital self-harm and physical self-harm. What we don't yet know is what is the sequencing of that, right? Is it that somebody kind of starts out by engaging in digital self-harm And if engaging in that behavior doesn't alleviate their emotional state or their mental state, that they then graduate to physical self-harm. Are they co-occurring behaviors, right? Is there a causal sequence, or are they just correlates? And then the same question, I think, pertains to that link between digital self-harm and things like suicidal thoughts and attempts. Is it that digital self-harm actually causes those things, or might it just be a precursor, a red flag, a stepping stone that might be an indication that a youth might be at risk of engaging in suicidal behavior? So, the paper we have under review right now is based upon largely cross-sectional data. So, what is really needed, and this is probably true for a lot of things, is longitudinal panel data. Having longitudinal data on digital self-harm, where you can measure engaging in digital self-harm, suicidal thoughts and behaviors, various emotional states, and multiple ways of data with the same students would be the single thing that would advance that area of research the most. But it's obviously complicated by the highly sensitive nature of the topic, and the additional precautions and steps that probably would need to be built into that type of design. Because if you have somebody who's self-reporting suicidal thoughts and behaviors, depending upon the particular setting, there might be automatic legislative triggers that require some type of intervention or reporting of that. I'm not well versed in that particular topic, but anyways, a longitudinal panel study with repeated measurement of digital self-harm, physical self-harm, and suicidal thoughts and behaviors would really help to move that area of research forward.
Thank you. That's a really interesting line of research and a really interesting phenomenon. I knew nothing about it until the research that you did. So I appreciate you informing us all about that.
Thanks for the question. Who else? All right, well, if you do have any other questions for me, if you'd prefer to follow up with me privately, my email is there. I'm also quite active with my research and promoting my department on Twitter and other social media platforms. So I do thank everybody for attending the webinar and learning a little bit about the FYSAS. Hopefully the result of this will be Waleska's email inbox will be flooded with requests to access and get copies of the FYSAS data for research purposes. Because I only have so much time available to me to be able to work on research using the FYSAS. I certainly would love to see other researchers be able to utilize this really great resource that can, I think, address a number of important questions about Florida youth. So with that being said, again, thank you for attending, and I hope everybody has an enjoyable day. Thank you.